all. I certainly hope you're all having a little bit better weather than we are. It's been snowing like a banshee yet again, and I'm looking at the wind whipping it around out there. I think I'm closing the blinds and not looking anymore. This morning, I want to take this opportunity to introduce you to the Home Health Collaborative. I believe that many of you may have participated back, I think it must be almost 8 years now, in what was then the 8th scope of work, the Medicare QIO Quality Improvement Project that was focused on reducing acute care hospitalizations. And then somehow CMS lost sight of home health on its quality improvement radar. They certainly haven't lost any time focusing on us in other ways, but they did not continue to include us in their quality improvement work. At long last, with the 11th scope of work as of August 1st, home health is once again been recognized for the critical part of the healthcare continuum that we are. The portion of the 11th scope of work that involves home health providers is entirely focused upon improving cardiovascular health. And that's what we're going to talk about today, how the QIN QIOs came to be, what our goal is, how we might be able to work together, and how I hope I'm going to be able to show you that this is not going to put any additional burdens on you. By way of explanation and maybe a little defense of what I'm saying, I have been a provider. I ran my own agency for a little over 10 years. I have over 30 years experience in the home health field, and a lot of it is current. Every day of the week, I work with home health providers in 3 of the 6 states. Directly, working with them to solve their audit problems and all of the other issues that come up in the daily life of a home care agency. So I do know the struggles that you're facing, and I would not be here today asking you to work with us on improving cardiovascular outcomes if I didn't think that it was not only critically important for your patients, but also important for you in the long term for your survival. So let's begin this morning, as I said, by introducing the New England QIN QIO. CMS just loves acronyms and initials. We are the New England Quality Innovation Network Quality Improvement Organization. This represents a joint effort that is led and administered by health-centric advisors out of Rhode Island, and we at Qualidigm are their partner. We took the 6 New England states. We are sharing the workload and each assuming primary responsibility for working with the providers in 3 of the 6 states, so that a health-centric advisor has been assigned as the home health lead for Massachusetts, Maine, and Rhode Island, and a home health advisor has been designated for Connecticut, that's me, New Hampshire, and Vermont. I'm going to start this morning by welcoming those agencies who have already signed their participation agreements and joined our project. We work together, agencies from all 6 states, in this home health collaborative. Here in Connecticut, these are the agencies that had already signed participation agreements up through February 28th. As of today, we've added a few additional ones, bringing the Connecticut total up to 20. My email address is there up on the top, and all of the Connecticut agencies know that they can reach out to me directly at any time. In Massachusetts, South Coast VNA has already joined us. We hope to have as many more as we can, and Pat McLeod and Barbara Davis are eager to hear from you. Their emails are right up there. In New Hampshire, Georgette is your primary contact, and she's backed up by Leslie. We currently have 3 as of the end of February, and if memory serves me, I believe Georgette has added 1 more. In Rhode Island, please reach out to Brenda Jenkins. We urgently want to talk to you. We know that you're struggling with face-to-face, as everyone is, but we really do want to help. So call Brenda, email her, and sign up. In Vermont, you'll be speaking with Gail Colgan. This slide needs updating. We're really sad, but Mary had a better opportunity, she said, or at least a different one, and she has left us. In Maine, you can reach out to Doreen. And hopefully next month, we're going to have agencies participating under every single state. So if your agency signs a participation agreement, what does that mean for you? One of the first things that we would be asking you to do is to participate in the Home Health Quality Improvement, HHQI, program on their website. Many of you have already registered on the site. Your agency's name is up there. You have an in-house champion. It may be a holdover from the 8th scope. Perhaps you found it, your quality manager found it, and you've been using some of the tools over the last few years. But now, if you haven't registered or you haven't updated your registration, we'd like you to go to www.homehealthquality.org. And on the home page, you're going to find a registration tab. If you've already registered once before, check the fields, make sure that you've updated them. Identify and designate your agency champion and a backup person. I guess you're going to have to let that champion take a vacation every once in a while. I don't get them, but maybe you do. And then please explore the site and all of its exciting resources. This is what the home page looks like on the website. Right in the center it says, join the campaign, register now. And you will see up there on the right, second from the right, it says registration. That's where you will enter there to get your login and password set up. That will be the very first important step. Once you've done that, read the paragraph below talking about the national campaign to improve cardiovascular outcomes. Everything on this website is absolutely free. And as we go through, we're going to talk a little bit more about some of the tremendous things that are available to you here and how you can use them to your advantage. Not only clinically, but there are some financial advantages to this as well. There we go. In the center there, you will have seen the tab for the Cardiovascular Health. When you click on that, there's a drop-down with several items. The first one you want to go to is the CardioLAN. There's the website. It's a live hyperlink. After this program, you can get there by simply clicking on this link in the slide deck that has been sent. If you click on the blue button on the left, you can complete your registration into the CardioLAN. A LAN is a learning and action network. It's a place where we all come together. Once you've completed the registration, the website will show you that there are 6 quality measures you can pick from. These are all focused on our ABCs. This is aspirin use, blood pressure control, cholesterol control, and smoking cessation. There are 6 to choose from, and all of them will help you to improve the cardiovascular outcomes of the patients that you see. There's the website. There's Cardiovascular Health right in the center. Once you click on the LAN, here's the page you will see. There's that big blue button. It says Join Now. Click in the middle, and you will register there so that you can identify your in-house champion and get access to all the wonderful materials that are there. Look at the left side. CardioLAN is in blue. Below that, indented, are the webinars. Even if you happen to miss one, it's never lost. All the webinars that these wonderful folks at HHQI have done are available to you. They are all recorded. The important thing I want to point out to you, and I confirmed it yesterday, I spoke to Cindy Sun about the webinars. The majority of these webinars offer 1 CEU. And if you and your nurses require CEUs for your licensure or any ongoing certification, this is an ideal, cost-effective way to go about it. You can log on to the webinar, register all of the staff in your agency. They're in the room, participating. And at the end, at no cost to you, you've got one CEU for every clinician. What a wonderful way to do it. And you have just saved your quality manager, your staff educator, the clinical supervisor tasked with this responsibility. You've saved them the time and the cost of having to develop one, write it, present it, and manage it, and submit for the CEUs. This way, you and your staff have benefited from a cardiac-focused program and gotten the CEU, and all without having to spend precious resources. So that's what you need to do to get in there. Let's look at those measures again. I said to you before that there were 6. One of the first is the diabetes cholesterol control. It's looking specifically at LDL. You want to be looking at this because this is going to affect the overall well-being and restoration of the well-being of your diabetic patients. Anticoagulants, the use of aspirin, is a critical factor in the control of ischemic vascular disease. We need to have these people anticoagulated at the proper level. This particular measure is going to give you some very good data about how this is progressing in your company. Hypertension, controlling blood pressure. There are 2 measures. One looks simply at, in the course of the episode of care, were you successful in controlling blood pressure? The second one looks at, was there an effective follow-up plan taught and in place? The 5th measure addresses ischemic vascular disease and a complete lipid profile for LDL control. And the 6th and final one is screening for tobacco use and cessation interventions. How will this work on the Quality Improvement website? If you've selected a measure, exactly what's going to happen. Next week, on March the 11th, we will be having another webinar. Today's program was originally run on February 18th. We will be doing these webinars every month for those agencies who participate in the collaborative. Next week, on March 11th, the March program is going to focus a great deal on the actual data collection process, how easy it is, how very simply it can be done. Remember those 3 or 4 hours that you saved by having your staff attend and get the CEUs from the HHQI monthly webinars? All I need from you is about an hour to an hour and a half of that time, because the actual data collection process for this program will take no more than that. And if you don't get the data uploaded every single month, the world is not going to end. We will be very happy if you collect data and submit it to the website once a month, once a quarter. That will be fine, as long as you submit some. On the 11th, we will take you through the process of exactly how it's done, but on the website there is a process flow chart and the chart abstraction tool. We'll be talking about the actual data entry process, although there is a free webinar that will walk you through it, as well as one that will help you to review the important data reports that you can draw from this information. This is what the process flow chart looks like. All the steps are there. I will tell you that this is far less complicated than it looks. They are going to be only looking at having you enter data from discharged records. If you selected smoking cessation, smoking cessation is linked to a group of ICD-9 codes. When you transmitted your discharge oasis, those cases with one of those ICD-9 codes listed in their oasis are going to be pre-populated when you go into the data registry. You only need to select a maximum of 12. The first 3 of the 5 data elements are already going to be populated. You'll answer the other 2 questions, save and load, and you're done. If your agency's smaller, you only had 4 records that happened to meet those criteria for this month, that's fine. You only needed to submit those 4. Load, and you're done. You could finish your data collection for that month, if you're a smaller agency, in probably less than 20 minutes. So by having the questions for the data collection put into the patient's record, this data abstraction tool right here, if it's put in the record with the initial intake, so that your nurse, when she discharges the record and completes the discharge transfer oasis, she can answer the questions for whichever one of the outcome measures you are looking at. If you are looking at aspirin use, you only need to answer the one question under aspirin as appropriate. That's it. And have that nurse complete her discharge oasis, answer that question, hand the data abstraction tool over to the clerical person you've selected who's going to do the actual data entry. How much easier could it possibly get? The patient ID number, the start of care date, and whether or not they have both a Medicare and Medicaid number will already be there in the registry when you get to that section. So it truly is a very simple and painless process. As I said earlier, the Home Health Quality Improvement website offers you a significant number of other benefits. One of them is those old favorite best practice intervention packages. Remember those from the 8th scope of work? The people at HHQI do a phenomenal job every time they release one of these best practice packages. In fact, they do such a good job that the packages run 75, 80, 100 pages long. And I have heard many agencies say, the information is wonderful, but who on God's earth has enough time and energy to read them, pick out what works in my agency, and then implement it? I just don't have the time. So look at that. They've done Cardiovascular Health 1, which is aspirin use and blood pressure control. Cardiovascular Health 2, cholesterol management and smoking cessation. How can you use these effectively without overwhelming your staff? By being on these calls every month. Each month, I'm going to go through a look at the data you've put in, what it's telling us at the state level, because remember, trust me, I'm reassuring you here, CMS is never going to see your data at the state level, at your level, only at the state trend level, not agency specific. And when you use the BPIPs every month on these calls, I'm going to pull out a section and I'm going to help you to work on a portion that is manageable and easy to use. So look at those 6 measures. Select only 1, maybe 2 at the most. Identify the section of the BPIP that relates to that measure only. Pull the staff and patient education materials, which, by the way, will always be available in both Spanish and English. Pull the podcast, anything that applies to that measure. By using just this targeted approach, you're going to be able to decrease the stress on you and your staff. Let's take an example. Measure 204 is the use of aspirin therapy in patients with ischemic vascular disease. In the first BPIP, cardiovascular BPIP number 1, there are 4 pages that apply to clinical education. There's one 20-minute podcast that you can use as part of a staff meeting, a sample bulletin board that you can build or not as you please. There are 4 very specific, very useful English and Spanish handouts on the use of aspirin therapy. These are designed for your patient, and they were very specifically created at a 5th grade literacy level so that you can be sure your patients are going to clearly understand what you're giving them. And I showed you the data abstraction tool. There's 1 question for the use of aspirin therapy. That will make it so much easier for you to simply enter what you need to enter, the answer to that one question at the end of the month for the reporting component. What else is involved in participating in the Home Health Collaborative? As home health providers, yes, our primary focus is the care of our patients in their home where they reside. As community health agencies, home care and hospice providers also are a part of the larger community. We should be also looking at the bigger picture, promoting the health and well-being of the whole community. Have you heard about the Million Hearts campaign? Million people every year will have some type of a cardiac-related incident. We want to save 1 million hearts. If you go to this website, all we are asking you to do, and there it is, all we are asking you to do is to indicate that you agree that it's critically important that everyone do what they can as an individual person to promote cardiac wellness and help to save 1 million hearts from a heart attack or a stroke. All you need to do is show your commitment. In the upper left, you can see where it says, show your commitment as. Click on the drop-down. You can sign on as an individual, or you can sign on as a healthcare organization. When you click the Get Started button, it's going to ask you if you are willing to take the pledge to be a supporter. If that is the only thing you do, is that you take the pledge and say, I support this campaign. I believe that the goal of this initiative is the right direction for us to go as healthcare providers. That's all you have to do. Simply register your support. You can choose to do more, and that's a wonderful thing that you might be doing for your staff and for your community. A simple thing you may already be doing: blood pressure clinics out in the community, distributing appropriate diet and medication compliance literature and encouragement at those community events. That's supporting Million Hearts, and you're already doing it. You might also be already doing other things. If you registered your agency as a healthcare provider, you might select one activity to promote cardiac wellness. Here are some examples. There actually is a brand new vending machine company that promotes healthy snacks in the workplace. They actually have someone who comes out to your office every day to put fresh salads in the vending machine. Now, that's something I could live with, and that would show your commitment to the Million Hearts campaign. If you posted, this is a no smoking campus, and your no smoking policy in your agency, you supported the Million Hearts campaign. You have a staff meeting, a company event, and you serve heart-healthy food. It doesn't mean you don't have pizza. It means it's a veggie pizza, and you have a large salad available. You have a fruit bowl instead of those wonderful chocolate chip cookies. That is supporting Million Hearts. And that's the best and easiest thing you can do. You supported your staff. You're supporting the community as a whole. It didn't cost any money, and it isn't going to involve expensive staff time in ways that you simply can't afford. And I recognize that. What's Interact? I'm simply letting you know about the Interact program. We are not, I repeat, we are not going to start teaching and using Interact or promoting the use of Interact for home health until sometime in the fall, most likely September or October. But you may already be seeing some of the Interact tools. Interact is being highly promoted, strongly encouraged by CMS in the long-term care, skilled nursing, rehab facility world. Interact stands for Interventions to Reduce Acute Care Transfers. It provides a whole set of tools that facilitate effective, successful transitions of care, effective, successful medication reconciliation. It has proven to significantly reduce the nursing home world outcomes that are transfers to acute care facilities. Their acute care hospitalizations and emergent care are coming down the more they use the Interact tool. And so based on that, that's what we need to have you do, is just go to the website, take a look, cruise around. If you feel like using some of those tools, go right ahead. Otherwise, we will be doing that at a future date, not for the time being. This is what Interact looks like, but as I said, it's just an FYI for now. What's peer-to-peer sharing? For those of you who've been in home health as long as I have, and I'm not about to fess up to how long that is, I can tell you that there was a time when we worried a little bit less about enforcing our boundaries, and this town is mine, not yours, but we really focused on getting the information out to the community, and we worked together. We shared things with each other. If our goal as a collaborative is to improve the outcomes of our patients' episodes of care, by working together, sharing ideas, and helping each other, everyone's outcomes will improve. I remember a time when we used to share process, suggestion, and help each other on a regular basis. So we are offering a peer-to-peer sharing every month on these calls. We will be having a space of time, 5 to 10 minutes, where you can appeal to one another for help with a project that has to do with the Home Health Collaborative to improve cardiovascular outcomes. We can't help you on these calls with face-to-face or ADRs, but we can help you with how do I get my nurses to use this tool? What are you doing about the data collection? How are you improving this outcome or that one? Those are the kinds of things we want to work together on. And so we will be having a peer-to-peer sharing time. You can send your questions to any one of us. The emails that were at the beginning for the home health lead for your state. We'll bring the topic up if you are not comfortable. During the peer-to-peer sharing section of this call each month, we'll be the one to read the question and simply say, one of our members of the collaborative has a question. Here's the question. How have you, and we'll describe the concern, the issue, or the problem. And hopefully somebody out there, maybe 3 states away, has already come up with a solution. Every third Thursday, HHQI offers an educational webinar. Next week, in this month, we have our webinar. The following week, HHQI has theirs. So every month when we have our webinar on the second Wednesday, I'm going to be reminding you to go back online to HHQI and register for their monthly webinar so that you can have access to this wonderful educational resource for you and your staff. And don't forget, all the previous webinars are on there, archived for your future use. So that's what I have for today, and I hope that it's been helpful. As I said several times throughout, this project is open to anyone in any one of the 6 New England states that would like to join us. I promise you it will not be a burden. I promise you that working together to improve our outcomes, you will be able to use the improved outcomes to increase and secure your market share and to make yourselves even more marketable to the ACOs, the hospitals, and all of those factors that are out there dominating our world today. If you have questions, I'm happy to stay on the line for a few minutes so that people can put their questions forward, and I'll try to answer them. Megan, do we have any questions?
It just looks like we have, give me 1 second. This is Kathy Evans, who actually was not on the slides, but she is the state task lead for B1 and B2. So just as a heads up for that. But other than that, does anyone else have any other questions? It doesn't look like we do, so thank you everyone for attending, and thank you, Kathy, for your wonderful presentation. If anyone ends up having any questions, you can just email me them, and I can always contact Kathy through them, or you can use the slides to contact them. Thank you again. Again, this is recorded, so expect an email from me hopefully by the end of today with access to that recording, and I hope that you all have a wonderful rest of your day.
Thank you. Drive safely.